Hi, my name is Dr. Yvette Lu, and I'm a family physician. It's been about a month now since I made my first video answering questions around the novel coronavirus, and I thought it would be important to do an update and address some of the issues that have come up in the last month. Let's start with where are we at now? Fortunately, I have good news. Around the world, in many areas, we are seeing the curve start to flatten and bend. We are seeing that the number of new cases is coming down. However, now is not the time to let up. Now it is critical to continue our physical distancing measures. We are seeing that the physical distancing measures are working and they are slowing the spread of COVID-19, but we can't stop. Think of it like we are coming down a mountain in the darkness. The physical distancing measures are like brakes. They are slowing our descent down the mountain. However, if we let up on the physical distancing, it's like releasing the brakes. And because we still have a long way to go, we'll just tumble down the rest of the mountain in the darkness. That's why it's important that we maintain our physical distancing. Here in British Columbia, we are doing quite well. We started physical distancing and requiring people to isolate for 14 days after coming in from outside of the country very early on, and our curve has flattened. However, even in our case, our success is very fragile, and modeling released by the provincial health officer this week showed just how fragile it is. Let's have a look at the modeling released by our provincial health officer last week. You can see from this slide that if we reduce physical distancing early, the number of cases begins to rise very rapidly. That's why it's important that we maintain what we are doing now until the number of cases goes down. When can we open up again? Let's have a look at this slide again. If you look at the curve that we're on, you can see that the number of critical care cases goes down to zero or near zero around mid to late May. That is when we will be able to start thinking about opening up and increasing contact again. Now, when we make a change, because the incubation period of this virus is around 14 days, the change will happen very slowly because every time after we make a change, we have to wait 14 days at least to see what kind of impact that change has on new cases. So expect opening up to happen very gradually. When we start to open up again, public health officials will be testing and tracing cases very strictly because we want to be able to catch any new cases and be able to catch and isolate them and all their contacts so that the virus doesn't start spreading in the community again. So as a result, it will be very important to have testing capacity before we open up again. If we can successfully keep the number of cases down, then it's possible that public health will allow our society to open up even more. However, if we see the number of cases beginning to rise again, then most likely things will have to shut down again and we will have to increase physical distancing. Plan for an unusual life for the next 12 to 18 months until we have a vaccine or until we have herd immunity or community immunity, which is when a large proportion of the population has immunity to the virus. If you have a business, especially one that brings customers into your store, you should start thinking about how you can physical distance your customers and your staff from the customers. Any aspect of your business that can go online, like payments or ordering, should go online, and you should start planning for that now. With regards to large events, most likely these will not happen this summer. Large events like concerts, music festivals, fairs, these will likely be too dangerous to happen this summer. We just can't have that many people gathering in large numbers in close contact while the virus is still spreading. Now, this will not be forever. This is just for right now, and it's important right now because we don't want to have another surge of cases. Why can't we just let everyone get the disease? Some people have suggested that we just isolate the vulnerable people and let everyone else get the disease so that we can have herd immunity faster. The reason why we can't do this is because we don't always know who will get the sickest with the novel coronavirus. There are some known risk factors like heart disease, diabetes, high blood pressure, and we know that people who have these conditions tend to get sicker with COVID-19. However, we are also seeing a lot of young people who have no comorbid conditions, a lot of middle-aged people who have no underlying illness who are getting seriously ill from COVID-19. And that's why we can't just let the virus run rampant in the community. If we do, we will see lots of people who need ICU treatment and critical care treatment at the same time. And once again, we're going to see a surge that we're trying to avoid with our physical distancing. What is the role of antibody testing? When we have an infection, our body makes antibodies to fight that infection. Think of antibodies as like little specialized soldiers that run around in your body and help the body heal from viruses and bacteria. These soldiers are very specialized and they stay in our body after the virus or bacteria is long gone to help protect us in case the virus or bacteria tries to attack us again. Now, we have special tests and we can detect these specialized antibodies in the blood. And when we do, then it shows that the person has had an infection to that particular virus. So what we're going to see in the next few weeks and months is that antibody testing will start. And if you think you've had COVID-19, then you should probably get an antibody test to confirm it if you haven't been tested for it already. And this will tell you if you've had COVID-19 or not. Now, public health officials will be able to use these results of antibody testing to see how much of the population has immunity to COVID-19, and this will help them to decide how much of society they can open up and the timeline of that. If you have antibodies, you most likely have immunity to the novel coronavirus. However, we don't know yet how long that immunity will last. There's a type of therapy being tested right now called convalescent plasma therapy. What this is that we take the serum, which is like the liquid part of the blood, from people who have already had COVID-19, and we give that serum to patients who are sick and suffering from COVID-19. Now, the great thing about this is that the serum contains antibodies, and these antibodies work even though you take them out of one person and put them into another person. Convalescent plasma therapy has been used in other diseases successfully, so we're hoping that it will be one of the options for therapy for coronavirus. If you think you've had COVID-19, you may be a candidate for donating serum. Please contact your local blood services agency. That's the agency that manages blood donations. In Canada, that's the Canadian Blood Services, and in the United States, that's the Red Cross. Both of them have currently trials, and they are recruiting people to donate their serum. What do I do if I have a non-COVID-19 health concern? If you have a non-COVID-19 health concern, or a COVID-19 health concern, it still is very important to contact your family doctor. Family doctors are available. They're working mostly by phone and by video. So you can see your family doctor without even leaving your home. If your family doctor assesses you and decides that you need to go into the office to be seen, they will help you navigate that safely. Our offices have procedures to make sure that they are safe for patients. It's very important that you keep in touch with your family doctor at this time. We're not doing things like pap tests, which are preventative care, but we are seeing infections, injuries, and other illnesses. We are also keeping in touch with people who have chronic conditions, especially for people with diabetes, high blood pressure, heart disease. These people are at risk of having more serious infection with COVID-19, and it's very important for them to stay in touch with their family doctor so that their conditions are well managed. We don't want anyone with a chronic condition to have it worsen during the pandemic because of lack of contact with their family doctor. Now, it's also important for people who have mental illness to stay in contact with their family doctor. A lot of people have been noticing more anxiety, depression, or just their symptoms of mental illness acting up. If you have new symptoms of mental illness, or if you have a chronic condition that has flared up, it's important to contact your family doctor. They can help you manage your condition and connect you to resources that will be helpful. Now, finally, even though we aren't doing most preventative care, it's very important that children continue to get their vaccinations during the pandemic. We don't want to have a measles outbreak on top of everything else, and measles does not go away during a COVID-19 pandemic. So contact your family doctor or public health unit to find out how your children can get your vaccinations on time. It's very important that we continue to protect ourselves and our children from preventable infectious illness. Family doctors are also doing specialist referrals, and I found that actually some people are having easier access to specialists because of the cancellation of non-urgent hospital procedures. Specialist doctors are also doing consults by phone and video, so contact your family doctor if this is something that you think might be appropriate for you. Is it safe to go to the ER? People have been avoiding going to the ER during the COVID pandemic. It may be because people don't want to be an additional burden to the healthcare system, or it may be because people are scared of COVID-19. Either way, emergency doctors are noticing that people are presenting later in their condition. They tend to be more serious. Heart attacks, strokes, appendicitis, these things don't go away during a COVID pandemic. And all these serious conditions, it's very important to catch them early because outcomes will be better. If you have a serious acute medical condition, it's very important to go to the ER. The emergency rooms are safe. Staff have personal protective equipment. They will do whatever they can to keep you safe. If you're not sure if your condition is urgent, then reach out to your family doctor and they will help you assess whether or not your condition is one that needs to be seen in acute care in the emergency room. Do I need a mask? I've done a whole 16-minute video on masks and the evidence around masks. Briefly, masks can help protect you if you are in close and prolonged contact with someone who has the virus. So that is someone who is caring for someone who has COVID-19 or a healthcare worker who has to examine someone with COVID-19. Masks won't help prevent you from getting the infection if you're sort of out in the grocery store. However, they may prevent you from spreading the infection if you're asymptomatic. If you are wearing a mask, make sure you wash your hands before and after touching your mask. It's very important to have good mask hygiene. People are using various materials for masks because we are asking that people keep the medical masks for healthcare workers. So if you want to make your own mask, you can use cotton, at least 180 thread count, at least 2 layers. Make sure you wash your mask after using it. If you do put a filter in between the 2 layers, be very careful because some filters have microfibers. For example, vacuum bags may have microfibers that you can inhale, and these microfibers can damage your lungs. So you need to be very careful if you're going to be using any type of filter. Check out my video for more information about the evidence around using masks and for information on how to properly use masks and protect yourself when you're using a mask. Do I need to sterilize my groceries? There is the possibility that packages from the grocery store can be contaminated with virus if someone has, for example, coughed on them or someone with COVID-19 has coughed and then touched the packages. The consensus from public health officials is that you do not need to Lysol down all your groceries. You do not need to leave them outside for 3 days. In fact, if you leave your perishable items like milk and meat outside for 3 days, there's actually a high chance that you will get foodborne illness from them. So what they say to do is to make sure you wash your hands after touching any packaging and be sure not to touch your eyes, nose, and mouth. And also wash your hands before you eat. If you want to further prevent infection, what you can do is minimize your trips to the grocery store. Only go once a week or once every 2 weeks. Be focused when you're there. Just go get everything you need. Don't browse and shop around. And then you can also bring wipes or hand sanitizer. And when you get there, you can wipe down the handle of the shopping basket or the shopping cart. And then hand sanitize after you touch high-use areas like refrigerator door handles. Even if packages and groceries do have virus on them, they're likely to be a very small amount. So what you need to do is just wash your fruits and vegetables as you normally would. Don't use any kind of cleaning chemicals on them because the chemicals can be absorbed into the fruits and vegetables. Make sure you wash your hands regularly, especially after touching any kind of packaging, and clean your counters regularly, and you should be fine. Can I get the novel coronavirus from takeout or delivery food? The coronavirus is not like E. coli. You can't get it by eating it. However, you theoretically can get it, similar to the groceries, by touching packages that the food is contained in. So as with the groceries, I would recommend that you wash your hands after touching any packages that you get from takeout or delivery. You can further protect yourself by socially distancing from the delivery person. You can even get them to leave your package at the door and then open the door later and pay everything online beforehand so you don't have to have any contact with the delivery person. Be sure to tip them well as they are working very hard. If you're concerned, you can talk to the restaurant about their hygiene procedures, make sure that anyone who's sick is sent home and that they're cleaning their hands properly and that they are keeping everything in their food preparation environment clean. It is important to support local businesses at this time, and I know they would appreciate your business. Can I get COVID-19 from someone who runs or bicycles past me? When you're outside, the wind and the UV light makes it difficult for the coronavirus to spread. It's not like when you're indoors, when you're in close contact, when the coronavirus can spread more easily. There was some concern on the internet about bikers and runners running past and leaving a stream of air particles behind them. This is most likely not the case due to the wind disbursement and the air disbursement when you're outside. Having said that, I would make sure that you do keep a 2-meter distance between you and other people when you're outside. If you're running, I would not run a constant 2 meters behind someone in front of you because you may be breathing in their air for a prolonged period. So I would just take a different path. Don't run directly behind someone. If you're just sort of walking around and someone runs past you, that's probably fine. There's a very low chance that you'll catch coronavirus from that. But if you're a runner, there's a lot of runners around you, so you're sort of all running in parallel. I would just leave extra distance and even better, take a different route. That will minimize your risk of catching coronavirus from other athletes. Remember, 2 meters is the minimum, but more space is always better. Do I have pandemic fatigue? The last thing I want to talk about is what I'm calling COVID pandemic fatigue. We've been isolating for over a month now, and I've noticed in the past week, particularly in myself and others, that we're getting more restless. We just really want things to go back to normal. It's hard not to be able to see our friends and hug our family, go out to dinner. I think of it as running a marathon. So at the beginning, you have lots of adrenaline. Everything is like quite terrifying, maybe a little bit exciting. But as you proceed to run through the marathon, you become tired. That initial rush of adrenaline starts to wane and it becomes very tough. And that's sort of the time that we're at now. It's natural for our bodies to want to go back to normal. Change takes endurance, and this is not the routine that we're used to. I find that refocusing on the reasons why we have taken these dramatic public health measures is helpful in helping to cope with what's going on in our lives. I see tributes and obituaries, and sometimes I feel like looking away because they make me anxious or fearful. But when I feel strong enough, I read them and I look at them to honor the lives of the people who have passed away and to honor their families and their legacy. I also think it's important to honor the work of all our doctors, all our healthcare workers, all the people who are working in hospitals and all the people who are working in essential services, who are risking their lives for us so that we don't get the infection. Now, this week, I saw this fantastic 6-minute documentary in the New York Times by Nick Kristof, who's a journalist, and he went into 2 Bronx hospitals and documented what's going on there for the healthcare workers and their patients. I think this is a very powerful film, and I would highly recommend that you watch it to get an idea of what life is like there. I found that for me, it helped me to recommit to all the measures that we're taking for this pandemic. Everything that we're doing is for now. Please remember that it is not forever. Please be strong, be kind, and stay safe. Please check out my other videos. I have one about other coronavirus questions, and I have one about the evidence around masks. If you have any additional questions, please feel free to post them below, and I'll make another video in the future. Take care, and I'll see you next time.